the question raised by Honorable Kibagendi regarding payment of NHIF claims. Indeed, there has been a delay in payment of claims due to delay in exchequer release. Honorable Speaker and honorable members, as we speak now, NHIF owes service providers close to 30 billion shillings. And of these 30 billion shillings, 22 billion is owed to NHIF by government and other government entities. Honorable Speaker and honorable members, this week we have had a meeting with National Treasury, and yesterday the Principal Secretary for Medical Services did receive a confirmation from Treasury of a release of 5.5 billion for payment of claims. So we are expecting that once the money hits the account this week, then payment of the claims by NHIF need to proceed as from next week. But also want to clarify that payment of claims is an ongoing exercise. Last year alone, NHIF paid out a total of 36 billion shillings. So as claims continue to be verified and reconciled, they get to be paid as and when exchequer releases are available. The issue by Dr. Nyikal about the CBA, really a CBA is collective bargaining agreement between an employer and an employee. Medical cover is provided by the employer to an employee. So I still want to say, Honorable Speaker and members, that as national government, we can only take responsibilities for the employees that belong to the national government. And having said that, the issue of a CBA is not a policy issue. The issue of a CBA is what is signed and agreed between parties. But the ministry, we continue to play our responsibility in development of policies, and that is why at the moment we are working on the internship policy. Regarding Edu-Afia, Honorable Speaker and honorable members, this scheme came to an end, lapsed in December. Before lapsing, the Ministry of Health wrote to the Ministry of Education, informing them of the end of the scheme of Edu-Afia. We expected that then the Ministry of Education would write back and ask the Ministry of Health to extend that, but that was not done. So we did not receive an extension. However, Honorable Speaker and honorable members, I would like to confirm that under the new Social Health Authority, we now have a cover for all Kenyans. And this has expanded benefits package that besides Edu-Afia that was covering a student, the Social Health Authority Act now ensures that there is a cover for all members of the family. That includes mama, it includes the children who are in school, it includes the mzee who may not be at school. So we now have an expanded benefits package to cover all members of the family. Honorable Speaker and honorable members, the issue of the rate of death in the facilities occasioned by this crisis. Honorable Speaker and honorable members, the ministry has a tool on a daily basis that we get to receive what is happening in our health facilities. And from the national level, Honorable Speaker and honorable members, the rate of death has gone down. But as a ministry, we know it is because people have not been coming to hospital. So we want to go further and drill and see what is happening within the communities. And once we get to that point, then we shall conclusively say what is the rate of death based on the crisis. The question raised by Honorable Tongei regarding the policy that there is a discrimination. I would like to affirm that the policy is still under development. We have only done internal stakeholder validation. We have an opportunity for external stakeholder validation. And during such a process, comments, reviews, and suggestions are received from several stakeholders. And I want to believe that if that came through from their stakeholders, then it will be subjected to the process, and the document that we will end up with as the policy will be one that speaks to the needs of majority of Kenyans. On the issue of missionary doctors, the permits, Honorable Speaker and honorable members, are issued by Ministry of Interior. I would not want to comment on it. For us, we wait until they have been issued permits, then the Kenya Medical Practitioner and Dentist Council issues licenses for their practice. But that is an issue that has been raised by the faith-based organizations, and it has already been given to the attention of the Ministry of Interior to be able to look at it and see how do they rationalize And I want to agree with the honorable member that indeed the missionary hospitals, the faith-based facilities are playing a critical role during this crisis. Thank you, Honorable Speaker and members.
Thank you, Minister. We'll end there on this question. We'll now go to the next questions. Honorable members, the next ones, I'll allow the questioner and one joyrider so that we can make progress. Member for Ruiru, Simon Kingara, question 020 of 2024.
Thank you, Honorable Speaker. May I take this opportunity to thank you for granting me an opportunity to ask a question number 20 of 2024, directed to the Cabinet Secretary for Health. Could the Cabinet Secretary clarify whether the Kenyatta University Technical could the Cabinet Secretary clarify whether the Kenyatta University Teaching, Referral and Research Hospital imposes high deposit before attending to patients and that the NHIF cover caters for very minimal amount as compared to other facilities such as Kenyatta National Hospital and Kiambu Level 5. Number two, Mr. Speaker, sir, could the Cabinet Secretary provide details on the budgetary allocation provided to the hospital in the financial year 2023-2024, and further confirm that the Credit Control Department holds numerous title deeds for patients who are unable to meet the high medical bills and considerable number of bodies are locked at the hospital mortuary. Finally, Mr. Speaker, could the Cabinet Secretary elaborate on measures by the Ministry to ensure affordability, including offering the waivers of health care services within the facility, especially given the diverse income levels of the population of rural and neighboring constituencies that the facility serves? Thank you, Mr. Speaker.
Thank you, Honorable Speaker and honorable members. We need to clarify whether Kenyatta University Teaching and Referral Hospital imposes high deposits before attending to patients, and that the NHIF cover caters for very minimal amounts as compared to other facilities such as Kenyatta National and Kiambu Level 5 Hospital. Honorable Speaker and honorable members, Kenyatta University Teaching Referral Hospital does not impose high deposits before attending to patients. The hospital attends to all patients who come through either referral, through the specialized clinics, or through the outpatient department, or the accident and emergency department. These patients who come to this hospital, they are in most cases seeking highly specialized care since it is a referral hospital. At the accident and emergency department, patients are normally stabilized even before they are asked to pay the consultancy fee. At the outpatient department and the specialized clinics, patients pay a minimal consultancy fee as prescribed by the consultants. Deposits are only asked for where the consultant determines that the patient needs admission for continuation of care as explained hereafter. The hospital admits patients through the referral, specialized clinic, or an emergency basis. The hospital admission policy and procedures and the hospital referral policy are both informed and aligned to Article 43, Part 2 of the Constitution, which states that no person shall be denied emergency medical treatment. The admission policy and procedure section states that the hospital will ensure that no patient shall be denied admission due to race, color, religion, ancestry, financial class, nationality, or any other form of discrimination. In the same policy, in cases of emergency, there will be no financial obligation. The referral policy states that all emergency referrals to be accepted without fail and unnecessary delay or shunting of patients should be avoided. They will be given priority on arrival. Honorable Speaker and honorable members, on waived hospital bills, the hospital does not deny care to any patient who requires emergency care or admission on the basis of cost of care. Majority of these patients get admitted without the deposit, but with a promise to pay upon discharge. However, some do not honor their promise because they are genuinely unable to cater for their treatment costs fully. Others are only able to pay partially for the services rendered. As a result, the hospital has unpaid bills of 403 million since the hospital began 4 years ago. And this now has been requested in the budget for reimbursement. Regarding the NHIF cover, the hospital has a hybrid model that has both comprehensive and non-comprehensive covers. Patients admitted under the comprehensive cover do not top up for the cost of their care, including all required pharmaceuticals, diagnostic services, surgery, and medication. For example, for all patients under the national NHIF scheme, access surgery purely under the comprehensive cover. Under NHIF non-comprehensive cover, patients co-pay as outlined in the contract for different services. This arrangement is actually the same with that of Kenyatta National Hospitals. Patients at Kenyatta University Teaching and Referral Hospital have access to a whole continuum of care with a rare need to access services like imaging, special lab works, specialized consultancy outside the hospital. This is unlike the lower level hospitals where patients have to buy some items or seek services outside the facility, which translates to huge out-of-pocket costs despite the NHIF cover. On part 2 of the question, that we provide details on the budgetary allocation provided to the hospital in the financial year 2023-2024, and further confirm that the Credit Control Department holds numerous titles for title deeds for patients who are unable to meet the high medical bills, and considerable number of bodies are locked at the hospital mortuary. Honorable Speaker and honorable members, the hospital budgetary allocation for financial year 2023-2024 was 5.8 billion shillings, consisting of the GOK grant of 2.986 billion and the A&A of 2.9 billion. The development budget for the hospital is 350 million. The actual expenditure for PE is 3.988 billion against the GOK PE allocation of 2.986 billion. Hence, there is already a gap of 1 billion, which the hospital struggles to meet despite it not having the required staff establishment for optimal service delivery. In the next financial year, 2024-2025, the hospital requires a PE allocation of 4.072 billion from the government. In the Department of Credit Control, the hospital's Credit Control Office plays a crucial role in assisting families facing financial difficulties by offering credit payment plans. This initiative benefits both the patients and the hospital in several ways. The benefit to the patient is that elimination of unnecessary hospital stay. Patients can leave the hospital once arrangement for payment has been made, and this reduces their stay. Prevention of accumulating unmanageable bills. By entering into credit payment plans, patients can manage their medical expenses over time rather than facing a large immediate financial pain. Reduced risk of hospital-acquired infections. Due to the shorter hospital stay, they decrease the likelihood of patients contracting infections during the time in their hospital. The benefit of these payment plans to the hospital is that there is availability of hospital space. Releasing patients who have settled their payment arrangement it frees up space, allowing the hospital to accommodate other patients. Efficient resource allocation. By recovering debts through credit payment plans, the hospital can allocate its resources more effectively, ensuring that resources are available for patients who need them. There is also mitigation of budgetary limitations, thus managing outstanding debts, and helps the hospital to navigate the budgetary constraints that it experiences. The use of title deeds as security for these arrangements. Title deeds are utilized solely as security for the commitments made by the patients or their families. Once the debt are fully recovered according to the agreed upon terms, the title deeds are returned to their respective owners. This practice provides assurance to the hospital that the debts will be repaid, while also safeguards the assets of the patients or their families. Overall, this approach demonstrates a proactive effort by the hospital to address financial challenges faced by patients and their families, while also ensuring efficient operation of healthcare services within the constraints of budgetary limitation. The issue of dead bodies being locked at the hospital mortuary, the hospital preserves dead bodies for relatives as they make funeral arrangements. Some bodies stay longer in the morgue for long due to various factors. Some have cases arising from court and there are disputes, therefore the bodies are stay longer until the dispute is resolved. The hospital also has unclaimed bodies. We have delays from families as they fundraise and make funeral arrangements. Some families make requests to be allowed time to enable them to fundraise, since once a burial is done, it becomes difficult for them to mobilize funds. Where a family has requested for a waiver of a hospital bill, they wait for the outcome of the waiver process. The process involves socioeconomic analysis, and at times, it involves a home visit to enable an objective determination of the request. Part 3 of the question, to elaborate on measures by the ministry to ensure affordability, offering of waivers for healthcare services within the facility, especially given to the diverse income levels of the population in Ruiru and neighboring constituencies that the facility serves. Honorable Speaker and honorable members, the Ministry of Health is currently on course in the establishment of the Social Health Authority and the seamless transition from NHIF. The Social Health Authority will provide social health insurance up to 85% of the population in the formal and informal sector. The government will continue paying for the indigents and the vulnerable populations. These measures will ensure that most Kenyans, including the poor and the vulnerable households, will have a form of prepayment of health insurance anytime they visit a facility, and they will not have to pay from out of pocket. The Social Health Authority, together with the Ministry of Health, has developed a comprehensive health benefits package enough to cover at least 70% of the prevalent conditions. The citizens of Ruiru and Kenyans at large will have to register and contribute to the social health insurance depending on their ability to pay in order to access services, not just at Kenyatta University Teaching and Referral Hospitals, but within other facilities. The Ministry of Health has also come up with a clear communication strategy on universal health coverage that will sensitize citizens on the need to enroll in social health insurance and therefore be able to benefit on the expected benefits from the Social Health Authority. Honorable Speaker and honorable members, I hereby submit. Thank you.
Member for Ruiru, you're satisfied? Give him the mic. There you are.
Thank you, Mr. Speaker, sir. The questions are necessitated by discomfort of the community, and as it was answered to us, there are some areas which maybe I need some clarification, if you allow. Mr. Speaker.
Just seek one clarification.
Yeah, actually it's one clarification.
Yes.
Mr. Speaker, at the last bit of the answering, the minister said that the bodies or the documents are held because of arrangement by families or the same. But Mr. Speaker, there are documents held by that facility, and I have evidence for more than 2 years. So my question is, how long can the facility hold the documents for the concerned family or the deceased person? And secondly, maybe how long also can they hold the body, because you also know bodies which have been there for many, many months or years. Thank you.
Waziri? Sorry. Magali Mulu? Yeah,
Thank you, Honorable Speaker. Honorable Speaker, it looks like I misplaced my card, so I want to thank you for giving me the chance. Honorable Speaker, I want to ask a question which is related to the issue. Although this question is specific to Kenyatta University Referral Hospital, I think the bigger issue, Honorable Speaker, is the issue of the cost of treatment in this country, both medication, consultation, and all things to do with surgery. And Honorable Speaker,
Makali Mulu, I've given you an opportunity to ask a supplementary to the specific question asked.
My specific question, Honorable Speaker, now that we have the CS here,
is
there anything the ministry is doing, Honorable Speaker, to bring down the cost of medication in this country and treatment? Because I think that's a bigger question, Honorable Speaker. in this country.
Okay. Minister, answer the two. Esther, you have two questions, so just hold your horses. You can combine whatever you want to ask within your questions.
Thank you, Honorable Speaker and honorable members. On the issue of how long the bodies should be kept and should the documents be kept. Honorable Speaker, as I submitted earlier, before this is done, there is normally a conversation between the family and the hospital, and they agree on a plan. So once the plan is finalized, then the bodies are released or the documents are released to the family. But we shall retreat as a ministry to check into the ones you have said that they have stayed for very long. We are happy to get the specifics so that then we can address it with the hospital. Honorable Speaker, on the cost of treatment, the ministry has shifted focus from focusing on curative nature to now primary health care. Primary health care, Honorable Speaker and honorable members, is to ensure that we focus on prevention of disease. In itself is a way of ensuring that we manage the cost of healthcare. But furthermore, in terms of the commodities and other health products and technologies, the ministry has reinvented and is working specifically to focus on local manufacturers to ensure that other costs that are lumped on products and technologies, being that they have been brought into the countries, are reduced. And so far, the Kenya Medical Supplies Agency Authority has been able to implement the local manufacturing policy, and close to 50% of the items are now being sourced locally. Chair and honorable members, I submit.
Joshua Kandia.
Thank you, Honorable Speaker. I rise to